Hello, I'm Dr. Farine Karachuela, York Region's Associate Medical Officer of Health. Our wastewater data continues to show a slight increase in transmission within the community. Public Health Ontario's data is also showing a slight increase in the Greater Toronto area. And this slight upward trend is sort of like what we saw in July before the summer wave we had. After the summer wave, the numbers did come down, but they came down and then stayed at a higher level than what we had hoped. Because of this, we are now seeing a higher fall case count, even though it's earlier in the fall season. The other challenge, of course, is that we are also expecting an earlier flu or influenza season. So it's very possible that our fall wave will see both COVID-19 and flu at high rates. You can keep up to date on the latest COVID-19 trends in York Region by checking out our weekly updated dashboards at york.ca/COVID-19 data. Our hospital admissions due to COVID-19 have also slightly increased. Because of this, I am really encouraging everyone to be up to date on your COVID-19 vaccines. And remember, the whole point of being up to date with these vaccines is not to completely prevent COVID-19 infection, but to prevent people from becoming very sick or needing hospital care for COVID-19. As of today, a new type of bivalent booster dose is now available in all of our COVID-19 public health clinics. And this is the Pfizer bivalent shot that protects against the original COVID-19 variant, as well as the BA.4/5 Omicron variant. Everyone over the age of 12 is eligible to get this vaccine. The Moderna bivalent vaccine, this is the one that protects against the original COVID-19 variant plus the BA.1 Omicron variant, has been available already to everyone over the age of 18 for several weeks now. Either of these bivalent vaccines, Pfizer or Moderna, is a good choice. And really the only requirements to get either of these boosters is that you've had your primary series, so for most people that's 2 doses, and that it's been at least 3 to 6 months since your last COVID-19 vaccine dose or infection with COVID-19. Both the Pfizer and the Moderna bivalent provide good protection against becoming hospitalized or very sick from COVID-19 infection, particularly from Omicron strains. The only situation where we clearly recommend the Pfizer over the Moderna is for those people less than 18 years of age getting the bivalent booster shot. Otherwise, either is a good choice as they are similar in effectiveness against preventing hospitalization and serious illness. Also, keep in mind that while BA.5 is the dominant variant circulating right now in the community, we don't exactly know what types of variants will be responsible for an upcoming fall wave. Right now, experts think it's possible that the variants during the fall wave may be certain subvariants of either BA.2 or BA.5, or both. COVID-19 booster vaccines are extremely important to get as soon as you can and are eligible. Everyone over the age of 5 can get a booster, and everyone over age 12 can get a bivalent booster. The boosters really help to amplify your immunity, especially against Omicron, which we know spreads fast. So please book your vaccine appointment now at york.ca/COVID-19 vaccine, or you can call Access York to help book at 1-877-464-9675. Now, while COVID-19 is still very present in the community, flu season and a time for many other respiratory illnesses is upon us. It's really important to stay up to date on your annual influenza or flu shot when it becomes available. We've had many residents ask how far apart these vaccines should be given, or whether you should get the flu vaccine ahead of the COVID vaccine or the other way around. My advice to you is not to wait. Get the COVID vaccine when you're eligible and the flu vaccine when it becomes available, which is likely end of this month or start of November. If you're over the age of 5, you can get these vaccines at the same time, which is safe, or any time before or after one another. Do not delay one vaccine while waiting for another. With an increase of COVID-19 in the community and chillier weather around the corner, Please remember to monitor for any new symptoms and stay home if you're sick, especially as gatherings have moved more indoors. This is one of the most important things you can do this fall. If you test positive for COVID, be considerate of others and wear a mask for 10 days in public spaces. And of course, stay home until your symptoms improve for at least 24 hours or 48 hours if you have any gastrointestinal symptoms like nausea, stomach pain, vomiting, or diarrhea. Let's all work together and do what we can this fall. And as always, thank you so much to this great community for tuning in, learning more, and doing what you can to protect yourself, your family, and our community at large.